here's one of my concerns. I know that they would have to have a coroner who is a sheriff would have to have the autopsy done by a pathologist. Now, do they use a forensic pathologist or do they use a hospital pathologist? I don't know. That's entirely up to each system. And in a small, it's a fairly rural, it's a mountain area in Northern California. I don't know who they're using, a forensic pathologist or a hospital pathologist who also does pap smears. So, I have that concern. They have to, of course, send the toxicology out. It could take 2 months easily. So when I read those reports, the news reports, there's something a little misleading there. It seemed to say that the autopsy would take 2 months. That's not what the sheriff said. What she said is that they're not going to release those autopsy reports until their investigation is complete. Ed, this might be one of what we call a CUPPI, the dreaded CUPPI, which stands for Cause Unknown Pending Police Investigation.
Yes, the dreaded CUPPI. That means we can't clear the case, and it sits there, and our supervisors start yelling at us.
That's right.
And here's what my friend has to say about that.
Oh, hell no.
That's right.
So the CUPPI, I mean, the medical examiner might say, well, based on the findings on autopsy, this young lady died of a drowning. And then when it comes to manner of death, which is homicide, suicide, accident, or natural, they have the choice of accident or suicide or homicide. Mm-hmm. So suppose she was despondent over a breakup with a boy and drove her car into the river. I mean, not that didn't happen, but I'm saying that's a possibility in life. Suppose someone pushed her car. Suppose it was accidental. She had a few drinks. She's only 16. It's a darkened area. There's 200 to 300 people partying. It's confusing. It would be easy to drive into that water. So how are they going to tell the manner of death? It's up to the police. And the police, or the sheriff, is going to take 2 months to figure this out.
She said she gave herself that buffer, that 2 month buffer.
Yeah.
Right. But you're going to do a full autopsy. You're going to look for blunt force trauma injuries. You're going to look to see if the seatbelt was being worn. If so, did the seatbelt cause any blunt force trauma injuries to the shoulders, the sternum, and so forth and so on? You're going to look at the hyoid bone. You're going to look for signs of asphyxiation, any other type of injury. You're going to do a sex kit. Okay. Yeah. All right. You're going to be thorough. You're going to dot your I and cross your T. You have to do that as well, right? Again, and then the water could cause an issue there as well with some of the tests that are performed in that kit.